understanding the trade-off actually help individual citizens? Policy questions that the government might have about these kind of long-term changes in the health of the population. And actually, when I talk about leadership, this is
With that, we'll perhaps move to our next speaker today, Associate Professor Dr. Alex Cook. He is the Vice Dean for Research at the NUS School of Public Health as well, and his work has contributed, he's an infectious disease modeler, and his work has contributed to policy in Singapore as well. So please join me in welcoming Dr. Alex Cook.
Okay, thank you so much. Can you hear me okay? I'm not sure about the mic. Is it on? Okay, fabulous. So thank you for the invitation to come. I'm slightly less grateful that you put me immediately after Gabriel's, one of the leading voices in the field of ID epidemiology. I'll try my best, but I won't be quite as good a speaker as him. Because we do have one of the world's leading ID epidemiologists here, I thought that rather than talking about the ID modeling work that I've been doing over the last few years, instead I would talk about some of the non-communicable disease modeling that we've been doing in the School of Public Health at the National University of Singapore. So I'm going to give you two examples, and then I'll talk a little bit about some of the lessons that we've learned along the way in academic-government partnerships. So the first example I want to talk about is from about 10 years ago. So it seems like it was just yesterday, but no, a decade ago, when my team was working on developing a simulation model that would allow us to upscale the kind of micro-level data that you get from epidemiological studies, cohort studies, case control studies, and so on. To upscale that to a population level, so that we'd then be able to take data that we're previously observing just at individuals, then see what would be the effect of changes to risk factors over long periods of time at the entire population. The intent of this was that we'd be able to answer policy questions that the government might have about these kind of long-term changes in the health of the population. We chose to use diabetes as our first case study for a few reasons. One, Singapore's a predominantly Asian population. Asians have got a higher risk of developing diabetes for everything else equal. In Singapore, we've actually had historically quite low diagnosis rates for diabetes. About half of people who have diabetes 10 years ago knew that they had diabetes, or half of them didn't know that they had it. And also because we had seen over the past decades that there's been a rise in risk factors, a rise in sedentary lifestyles, a more Western diet, which tends to put on the pounds a little bit more, and therefore we've been seeing a rise in overweight and obesity in the country. So we used modeling to pull together information from these different sources, from our own school's cohort studies to information from the government, from their cross-sectional surveys that they've conducted, from the literature, so we know about what's the relationship between the risk factors and outcomes. And we put these all together within the modeling framework, and that allows us then to look at what are the emergent properties of the system. It's a little bit like when in ID modeling you start with R0 and you see what the overall epidemic will look like. You go from individuals to the population. So after developing this big model, we then gave the results of it out to our economist colleagues. They tried to work out what the economic impact of diabetes would be. And then we wrote up a little paper about it. It's not one of these Lancet papers or New England papers that Gabriel has. Much more modest journal article. And for me, that was the end of it. I thought, okay, I've done my research, I've published my little paper, I can now go on to another disease. However, our former dean, before YY became the dean, insisted that no, that shouldn't be the end. I should go and speak to the media, the local media in Singapore about this, because we thought that the prevalence I was estimating for 2050, 15, 16%, he thought that was quite a big number and we should use that and try to generate some interest. So I'm a very obedient person, like I didn't follow instructions, or I did follow instructions, don't have any slides. So I went to speak to the media, and the journalist that I spoke to was like, hey, it's very boring what you've said. You've got 15%, 16%, who cares about these percentages? But 2050, Singapore should have a population of 6 million, so 16% of 6 million is 1 million. Hey, and that's quite an exciting number. So next page is the newspaper's got like 1 million diabetics in Singapore by 2050. And my health economist colleagues had suggested there'd be $1 billion of economic impact by the same time point. And so this kind of combination of an interpretable health outcome and an interpretable and large economic outcome, kind of generated quite a bit of, I guess, trepidation by moving it from abstract to something more concrete. Trepidation in the population as well as in the government. This trepidation built up over the next 1 or 2 years until eventually the Minister of Health in Parliament declared war on diabetes. So my little paper got cited in Parliament, which I thought was quite nice. So by declaring war on diabetes, essentially the Singapore government took a whole-of-government approach. So it wasn't just the Ministry of Health that was declaring war, but rather the government of Singapore. You had different ministries all getting involved with trying to tackle some of the causes. So for example, by making fitness more available for Singaporeans by subsidizing their memberships of gyms and so on. So the first of the take-home messages I want to talk about then is really about communication, the importance of communication of our modeling results. If we are just treating it as a percentage in a little scientific article, that's not going to get the kind of traction that we need. Rather, we need to translate it away from something that is abstract to something that's much more concrete and can be interpreted by the general population, but also by the policymakers. Because in the government, you've got a lot of technically excellent people, but the people at the very top are smart but not technical experts. And so we need to make sure that we're speaking about things in a way that will be understood easily by them. I think a second point along that same theme is that it showed the importance of maintaining ties with our government. I realize I say ties, I'm immediately thinking Thailand. So we need to make sure that we actually are continuing to communicate on a regular basis with the government. So we now have a series of regular meetings with the Ministry of Health in Singapore. I'm in the MOH building about once a month on average, just to have a meeting about this or about that. And that's really helped to kind of socialize the work that we do within the School of Public Health with the needs of government. And so that leads on to my second example. So a few years before COVID, which is now 5 years ago, gosh, I got a call from one of the people in MOH that I met regularly over the course of the last decade to say that he was quite worried, that the government was worried about a new concerted campaign by a large tobacco manufacturer to push for e-cigarettes to be legalized. So I'll give you a little bit of context on that. So Singapore has, at the point, had not legalized e-cigarettes. Tends to take a very cautious wait-and-see approach and see how it goes in other countries, and then if it looks like it's okay, then we'll follow suit. Now, the proponents of e-cigarettes were arguing that because they're less damaging than regular cigarettes, if we could get current smokers and switch them so that they'll now be vapors instead, then overall we may have less harm. However, opponents of e-cigarettes say, well, contrary-wise, they're more dangerous than not smoking at all, and therefore, if you legalize e-cigarettes, yeah, you may convert some smokers to vapors, but you'll also have non-smokers becoming vapors. And it's not entirely clear which of these will do the most harm at a population level. So after speaking with my buddy in MOH, I said, well, do you want us to model it? And he was like, yeah, could you? So I said, okay, we'll go ahead, we'll do a model of this. We built a model, a lot of uncertainty in the model. It's like in the early days of COVID, there's a lot of things that we didn't know because at the time e-cigarettes were not legal in Singapore. So we had to look to other countries and try to extrapolate from there to see what we think the effect will be in our country. The main findings from the study was that we think that, yeah, there probably would be some short-term benefits from legalizing e-cigarettes because you get a large number of people who are not able to stop smoking but may switch to vaping. But that in the long run, over most of the scenarios that we looked at, we would see that there would be more harm overall, and therefore we showed this to the Ministry of Health, the Ministry of Law, and after this, they decided to keep the ban, and therefore, to this date, Singapore just still does not allow vaping. Now, I want to just stress that it is not that we determine policy. It's not like MOH was sitting there waiting, twiddling their thumbs for us to come along with a modeling result, and it's okay now. You said it's no good, so we won't allow it. But rather, I am sure that we contributed to the decision-making process, perhaps by giving them a way to justify a decision that they already wanted to make, but now need to have like some objective scientists supporting that. So what facilitated these success stories? I think there's 3 points that I'd like to just stress. One is the communication I mentioned, so the quite deep and frequent communication we have with our partners in the ministry. The second is the wherewithal, the financial wherewithal to be able to do this. Most of our school's funding comes from the Ministry of Health. Therefore, we're slightly obliged to help them out when they come along with a problem. Otherwise, next funding review, we won't get so much money. But importantly, some of that funding is not tied to specific projects. In other words, when a policy question emerges, and usually the answer needs to be within days, if not weeks, we're able to quite quickly redeploy some of our existing resources to tackle that problem. That would not be as easily done if everything is locked up to a specific branch and you've got to wait a year before you get the results and start work on it. I think that the third and final point I want to stress is that we've also ensured alignment with academic rewards and this kind of activity. So in many other departments in the university, if you're doing work which is not leading to a paper, then that is a big no-no. You will not get tenure, etc. You won't get full professor. Within the School of Public Health, we value that kind of applied translational work, and therefore, hopefully, I will get my full professor promotion at some point as a result of some of this work that we've done with the government. So I hope in the last few seconds that I've given you a bit of a sense of how modelling can contribute, not just to the acute crises that Gabriel spoke about, but also to these kind of long-term chronic crises that would be akin to the climate crisis. I think that within Singapore, we do have this very useful partnership between government and academia, and partly that is just because Singapore is so small. It's literally just a 15-minute cab journey from us to them, and there's only the one School of Public Health, so they don't have a lot of our people they can go to. But nevertheless, I hope that Singapore does form a kind of a useful case study for some bigger countries to think about when they look at academic-government partnerships. Thank you very much for your attention.